This health innovation themed episode of Advancing Healthcare Through Simulation is brought to you by Amedico and Health Everywhere Hub. Welcome back to Advancing Healthcare Through Simulation. Today we're joined by Tara Klassen, Innovation Lead for Surgical Care Alberta. Tara is a translational scientist with 25 years of experience helping health systems translate evidence into practical solutions across the surgical continuum. Known as a trusted phone-a-friend for complex healthcare decisions, she works with clinical and operational leaders to navigate uncertainty and design surgical programs, technologies, and care pathways that are safe, feasible, and sustainable. So Tara, thank you so much for joining me on the podcast episode today.
Thank you so much for having me. I'm delighted to be here.
I'm sure you have lots to share. I'd like to start out by pulling from a description that you say you like to work as helping systems navigate big, weird, complex decisions. So tell us, what kind of challenges typically fall into that category in surgical care?
Well, surgical care inherently, we talk about it as a pathway of care, right? So this is where we get into things that are crossing portfolios, crossing parts of the care pathway, primary care, diagnostics, lab, depending upon what part of the body or which problem you have. Is it cancer? Is it benign? Is it chronic? Is it acute? There's going to be lots of conversations to be had with a lot of different players along the pathway. Then you flip it into a provincial role, which is what my role is as innovation lead. And then you get into the complexity of where the care is delivered, because we're looking at the things in that lens of what's local to that unit or that program or that site, what's geographically available within that locale. That could be municipal, that could be bounded as a corridor of care. Then we're looking at what a program is. So if we think about a cancer program or a urology prostate program or something of that ilk, then you get into where are the services provided, which specialists do you need to talk to, what does that look like in terms of, is that in Edmonton and Calgary, is it in Red Deer, is it regional, do you push it out to rural? And then on top of that, you get into the idea of the province, which is wherever you live in the province, whatever the pathway of care is that you need, you should be having access to the same level of care. So big, weird, shared, complex. Everybody has some sort of, we call them silos, but they're not silos. They're perspectives or programs or lenses or budgets or authorities or decision-making powers that's within their sphere of influence, what they're responsible for. My role sits across all of them, so I'm sort of like the glue between the bricks that help people navigate and understand where the benefit is, even if it takes transformation or change. So lots of things that are local but want to go global need someone to help understand what that is in local context and then support the change around it.
Definitely complex. You described that very well. And I think, people often think innovation as a new technology, but you're talking about systems and pathways here. So how do you help work through that or navigate it, as you say? Like, as someone who can science anything from devices to care pathways, how does that implementation science help turn ideas into real improvements in surgical care?
Well, so I'm going to say that really from my perspective, it's understanding what the uncertainty is. So when I think about innovation, this could be programs, pathways, services, processes, technology, drugs, devices, all of these things. It's really about not about the technology, but about the technology makes possible. So people who work with me often hear me say, what do you want to be when you grow up? But that, again, when you layer over that lens of what I want to be as a site or a clinical program or a pathway or whatnot, gets into that complexity. So what my role is to help support all of the different, we call them stakeholders, interest holders, leaders, decision makers, tangential fellows and friends in the universities, research communities, etc. We want to understand what their questions are, where the uncertainty exists, and then align the work that we're doing to support them in their decision maker. I think it's important for everyone on the call today to understand that my role is inherently by design to have zero decision making power, but come through the lens of if Tara ruled the world, what would we do? So I will come with rooted and booted recommendations based on what I've heard and synthesized from across the health system through all the different lenses to provide my leadership with recommendations. Whether they take them or not is above Tara's pay grade. So this is where we get into, I can science anything depending upon what leaders want to know, what their uncertainty is. And I will even say over the course of a lifetime of a project, whether we're working on, do we like the tech? Can we hold the tech? Does it work in our hands in an OR? Versus what is it going to take to transform a pathway of care entirely across the province to optimize what that tech makes possible? We might have a cyclical iterative journey of serial cycles of sciencing to actually address things, because you can't jump straight to the economic end of the pool if you don't understand the change that you want to make. And part of that is understanding what you're doing now. And if you didn't, do the other thing, where would you end up and what would that cost? So that's really what I mean when I say I can science anything. That's helped, again, filling those gaps between what is known and unknown and where the uncertainties lie.
Well, it sounds like your expertise and, that experience in working with all of these partners really helps in the innovation guide, as you will. With healthcare being incredibly complex, what are some of the biggest barriers you would say for implementing innovation across the surgical continuum, like from referral and preoperative care through recovery?
Oh my goodness. So I'm gonna step that back and just say, what is the biggest barrier to implementing anything in healthcare? And bluntly, I'm going to say cost. And cost is related to the fact that we are funded a very specific way in Canada, which is more familiar to the National Health Services in the UK or New Zealand or Australia than perhaps the system that we hear about from the United States, which is an entirely different ballywhack. Our challenge is that we get into what does the evidence say? And when we say that as a health system, we typically are looking at the peer-reviewed research papers of the world. Unfortunately, that tends to be a bolus of American science, research, etc., which then gets into the cost as a primary driving factor. When you strip away the money part from the conversation around implementation, then you get into the parts that I would say are the more, the bigger the change, the bigger the proposition, the bigger the value. But as much as the health system wants to solve problems and do things right, the health system is a slow-moving behemoth that knows what it knows now and kind of likes the way things are because they understand where the risks are, how to mitigate them. It's built for a certain pathway. The moment you start to change, people hate change, right? People hate change because they're change adverse and just don't like change. People hate change because they like doing the things that they know and are familiar with. People don't like change because it comes with the uncertainty around money and value and clinical and outcomes and all of these things. And then you have the extreme end of the spectrum, which is change is awesome, change is good, let's change for everything, when it's not necessarily supported. So what you have to do as a health system is try to hit all of those things around everybody's needs and wants as people are people. And then you have to bake over all of those clinical, operational, and corporate decisions. The thing that we frequently hear about within the health system is, well, I like it, I want to buy it, right? So even if the magic money tree grows, there are certain things that bound us within the health system or any public procurement space, which isn't, you can't just go out and say, I like it, I want to buy it. If depending upon level of spend, depending upon uniqueness, depending upon all sorts of rules, you have to follow in order to put something on contract, to be able to buy it to then be able to use it safely by passing the infection prevention control and the clinical engineering and getting the surgeons' hands on it and getting the nurses' hands on it and getting the opinions of people who aren't in the OR themselves, but downstream and upstream of the OR. This is where we get into having those conversations of, do we have a shared vision of what we want to be when we grow up? If yes, it becomes much easier in manifesting the magic money tree because we can all put our purses together. But until we all agree on what we want to do, what we want to be, what we want to change, there is absolutely no avenue there really for you as a single portfolio, single site, single space to shift the system. You might be able to bring it in locally. That's an entire different conversation.
That sounds like an incredibly difficult process. How do you move past that? That could take quite a bit of time, I would imagine.
Well, so this is where you engage early. And I think this is one of our biggest challenges that we see consistently in, I'm going to say, the health system as a whole is when we're looking at technology and innovation, we tend to get to a certain part, and I'm going to say the innovation journey. I'm not even going to tie it to the academics in the research space, but we come through, we have the idea, then we have a gizmo, then we have a prototype, then we want to take a look at it, maybe in or on a people or in practitioners' hands. And that's the point at which we start to think, ooh, we have an idea. Ooh, the health system should become involved. Ooh, we should talk to people. The reality is the earlier you go back, or the first part of the journey that you're on, that's where you start to engage your champions around. Is this the problem that we have? Is this the right solution for us? How do we co-design it, co-development, make it work? Not just so that it's usable clinically, not just because it provides us with outcomes, but it works into our sterilization protocols. It works into our workflows. We have the right people and resources to use it. The number of times that the things we want in the OR that we use as surgeons in wound care specifically, right? And it's not a surgical thing. It's something we put on in the wound in the sterile environment, keep that wound safe and clean and happy. We send that downstream. Who ends up having it? Our nurses on the unit, our wound care nurses, our NSWAC nurses who are wound care specialists, or, and heaven help them, our home care and continuing care teams out in the community who may or may not have the training on that very special dressing or gizmo or gadget that the surgeon put on the OR. I'm going to tell you, the moment that hits that interface and they don't know how to support that patient safely, effectively in that path of care, it's off that wound and you're getting the dressing that they know because they can take care of you safely under their licensure and mandate. So the earlier we go back to the beginning as a collaboration in making the tech thing, gizmo, gadget, process, system, otherwise, the more effective you are at crossing those boundaries into adoption because you've already addressed the uncertainty, right? You've built it into your process so that your people who have the questions, you're sciencing right from the go together. That's your accelerator button.
AMedico is the Alberta Medical Device Innovation Consortium, a pan-Alberta network of researchers, industry partners, and community members working to address the need for tailored healthcare technology solutions and interventions poised to reorganize, reinvigorate, and redefine Alberta's medical device sector. Health Everywhere Hub is Alberta's digital health hub, uniting programs, experts, and resources to accelerate the commercialization and scale of e-health and m-health technologies. Both initiatives are supported through the Major Innovation Fund, led by the Alberta Ministry of Technology and Innovation, which enables strategic investments to strengthen Alberta's innovation ecosystem. Okay, so as you know, this podcast focused on simulation. And where do you see simulation playing a role in the testing or implementing of these innovations?
Every time, everywhere, every step along the journey, by everyone who's ever going to touch, love it, pay it, unpack it, fix it, break it apart, use it on a people, see it, love it, call it George. I would say simulation fits in. Simulation fits in when you're making the thing. Simulation is when your ideation of the thing and you're in the prototype phase. Simulation is when you've made the thing and now you're trying to deploy it into clinical care and you're trying to figure out, who's grabbing what parts of which pieces of what to do. A prime example is if you're looking at training a critical care team. We think about it in the OR. Well, the patient's going to need some extra special love from the ICU, and we just send them on down the road, right? We're not thinking about nursing in the ICU working on a week shift, like a week-long shift with the same patient with an intense breathing, just to do a trial of something in a live situation in an ICU can mean that you have to train between 100 to 450 nurses for one ICU program just to do a month-long trial, depending upon how they're staffed and how they're rotating. Simulation gets you out of that environment back into a space where many people can come in, try it on the people, develop the protocol, help you support and understand without having to think about the resource intensity of training 150 to 400 nurses just to be able to do a trial. So simulation, when you want to learn, when you want to knowledge disseminate, when you're trying to troubleshoot, when you're making the thing, simulation is part of the pathway and process at every phase of the game. And I'm going to challenge that I think simulation, when I'm saying it and people are listening to it who are not familiar with the world of simulation, this can be everything from the scenario and role-playing pieces that we think about, patient engagement from the clinical practitioner. This can be the simulated environment for testing or cleaning or those sorts of things. This can also start to push the boundary around what can simulation be in relation to VR and AR and virtual casting and simulcasting. So can you actually create and support a simulated event in a rural and remote OR? And I'm going to pick on somebody like Slave Lake or High Prairie or, like all of these places that are very far away from urban academic centers. That includes our new medical schools or the polytechnics themselves. How do we put simulation? How do we support them in skills development, skills maintenance? They might not see a lot of these patients or cases routinely, but when it happens, we want them to be on their A game and not going, well, we think we had one 15 years ago. Like, this is where we get into what can simulation do? It can help you create, it can help you maintain, it can help you upskill, it can help you remote skill, it can help you practice, it can help you gain confidence just by replicating and doing something on repeat, which bluntly never happens in a clinical situation because you always have 15 med students in a room and one body in front of you. And there's only so many times people are going to let you touch them, right? When you're trying, simulation is wonderful for that. So for me, simulation is a key component of what we do daily as a health system.
Well, it sounds like you are obviously networked and connecting with many people, so working closely with the clinical, the operational, and system leaders. What is one lesson you've learned about aligning innovation with real frontline needs?
Okay, so the number one, do not assume the words you're saying mean the same thing to everybody on the and I know this sounds like a trite conversation, but I'm going to take a hot buzzword right now, sustainability, right? Sustainability as a word for many people can mean greener and environmental and planetary health. Sustainability can mean financial aspects of a healthcare system. Sustainability, as our policies state, are, better for the people, better for the patient, better for the planetary health aspect, but also better for the public payer system, right? You don't have to have all three things in order. But when I say sustainability, everybody on the call went to their own definition and nobody shared it, right? So even when I'm trying to say, hey, this gizmo, this innovation will make the health system more sustainable, right? That statement there sounds like a wonderful ambition, but it means different things to different folks. So, number one, make sure that you're using the same language. You root back to the foundations for the purpose of today's talk. This is what we're doing. Second part then becomes making sure that you're working together, if not on the same thing at the same time, you're working in parallel towards the same end goal. If you do not share the same North Star, with the people that you are working with on an initiative, even if it's, you're doing it through your own lens and your own portfolios and your own responsibilities and your own mandates. If you do not share the same vision, then everybody's going to be on their own quest, going in different directions. If you're lucky, maybe you'll align at certain points in the snakes and ladders conversation, but oftentimes that's where you get into opposition. So make sure that you're using the same language. Make sure that you're actually aligned, if not working together on a thing, right? What do you want to be when you grow up is the same thing for everybody, right? It's not doctor, lawyer, engineer. Like those are very different things, right? Plumber, farmer, right? Like you want to make sure you've got the same vision. And then we get into the OMG, how do we build the solution? So this is when we get to the cross-portfolio thing. The innovation will solve a problem. That's normally how the problem statements and the business cases around innovation are formed. Is this the actual problem? Or if you changed and transformed that entire pathway or transformation or invested elsewhere, would that problem disappear? Right? And an example that I like to give is the infamous wire localization for breast cancer, right? Everybody knows the wire in the Solo Cup and somebody driving across the city to go have breast cancer surgery, a lumpectomy. Nobody likes the wire. Everybody wants to get rid of the wire. If you think about the problem as being the wire might move as the woman drives between the diagnostic clinic and the surgery site, that's a problem that you can solve through the patient safety lens by bringing, DI closer, no driving, etc. What if we got rid of the wire? Right? You've gotten rid of the problem by changing the pathway, so that problem doesn't exist. That is that cross-portfolio alignment when it comes to innovation matches the system's problem. Again, making sure that where you're seeing the problem is actually the problem, not just now, but in future state, because you could spend a whole lot of time and a whole lot of money and a whole lot of effort to solve a problem that we no longer have.
Well, I love that. I feel like you've just given me a beautiful definition of collaborative practice that I can just put in my pocket for my IPE students. That's perfect. So now I'm going to hold you to that same language and say, from your perspective, what does truly sustainable innovation in surgical care look like? Not just today, but 5, maybe 10 years down the road.
So honestly, I would say that we're really looking towards what do we actually need to be surgery in our operating room spaces versus what kinds of things does technology made possible outside in more of the minor operating rooms, the minor procedure clinics, the ambulatory care spaces closer to home, because technology is not just about cutting something out of a person, but possibly stopping or eliminating, a progression of a thing. So an example that we've seen recently has been in the endoscopy space, right? So down the throat and into the esophagus and looking at the Barrett's esophagus. So the precancerous esophagus where the cells are going a little weird because of acid reflux and all of that jazz. We know that historically, if you had precancerous, you'd then be moving on until resection and starting that pathway towards get the bad parts out. But what if we can go in and either use radiofrequency ablation or cryo, right? Freeze those cells so that they're gone, right? Stop the progression before it starts. So it's not cancer yet, it's precancerous, but we've eliminated the problem so you don't have the progression downstream. This is where we get into the excitement around what is surgical innovation. I actually think that we're going to see an evolution towards the pathway approach around a disease, a body part, a practice that builds in this, what can we do early to spare or see who would take advantage of a less invasive process or more minimally invasive process so that we don't have to jump to the deep end of the pool every time and remove all of the bibs and bobs from you, right? Because the surgeons, that's really, for the most part, to cut is to cure is their solution. So now we're starting to see that evolution towards other approaches in therapeutics, interventions. And I would say pushing the boundaries towards diagnostic imaging, cardiac ablation, catheter labs, endoscopy, a lot of natural entries, so mouth, anus, anything that's a natural hole, not needing the laparoscopic approach. That's where we're seeing a lot of cool innovation happening. And so when we take that patient-focused lens and we apply that with the innovation and the practice space, we see where sustainability is. If we don't need to go to the OR in the first place, that's a much more sustainable pathway for many people. And the care then also tends to be closer to home. So that's where I think we're headed.
Which I'm sure most people would be very excited to hear about. And also sounds like it could have a real impact positively on the system overall. Like you said, equity, efficiency, safety. You think that, obviously it sounds like you do, but you think it holds real promise for improving these aspects?
Well, I think it's one of those, the old adage, right? Like the nail and the hammer problem, right? So if we think about you always have to cut is to cure and it's always headed to surgery, then you're always building every pathway towards more surgery, more solutions, more surgeons, more ORs. But we keep seeing that that is a physical constraint, that's a space constraint, that's a people constraint, it's a systems constraint, because we've actually just created a new pinch point within the system. And if you say, well, we now have all of the ORs in the room, well, then we're just going to shift that into inpatient bed capacity or other things. What we want to do is give patients the most appropriate treatment at the most appropriate time. This is that real move away from even personalized medicine into precision health, right? Achieving your goals and your end games. And that may mean surgery ultimately, but you might see surgery as the 20 years in your future after you've maybe tried a few of the minimally invasive approaches, or you've done the fertility sparing approaches because you're a woman of childbearing years and you do not want to go for an overt hysterectomy. You want to try some steps along the way to be able to preserve that family planning opportunity. Like, this is where I get excited because it puts the power back into shared decision making, the focus on what patients want, and then we bring the system around it to solve the problems related to that, not trying to over engineer on legacy systems that are potentially outdated for the way that we train people, the way where we provide care, the complexity of our patients. All of these things are limitations towards the system as it's built, and that's part of what we're trying to do with health system restructuring and refocusing, as well as to, again, bring that patient care focus back to the patients where they live and need care.
I really love that. It sounds like the system is building around, the person-centered care approach, and that's fantastic. I think I'm going to change directions here and ask you to speak a little bit about actively shaping two initiatives that are building this kind of infrastructure at the system level. So we have the Health Everywhere Hub and we have a Medico. And for listeners who aren't familiar, can you tell us what each one does, maybe how they differ, and how they complement each other in moving surgical and digital health innovation formed in Alberta?
Fantastic question. So I'm lucky enough, as many of us in the ecosystem are, to participate in two of the major innovation-funded initiatives from Technology and Innovation, which is the Health Everywhere Hub and the Alberta Medical Device Innovation Consortium, or AMEDICO. And both of these are, I'm going to say, if you envision the Venn diagram, right, two overlapping circles, the overlap in the middle is really the health system around providing care through the lens of electronic health and mobile health, or digital health platforms for health everywhere. By its name is providing health everywhere, right? Not just in the acute care spaces, not just in the four walls of the hospital, but out in the community, living at home, aging well, and the solutions and innovations being developed in those spaces for the right practice. And some of them are very high tech, some of them are very low tech for all their electronic or mobile health solutions. The Health Everywhere Hub is dedicated towards supporting that innovation ecosystem specifically. Then it overlaps with AMEDICO, which, as its name implies, is really about the spectrum of medical devices, which includes e-health and m-health and all that software as a medical device, but also expands into the gizmos and the gadgets and the implants and the things and other pieces. So in the middle, they overlap in the technology. Collectively, they have I would say, a focus on providing health everywhere in the province of Alberta. So you get that sort of multifaceted, rural, regional, remote, aging in place, First Nations, Indigenous wellness. You have, I'm going to say, women's health, child's health, all of these sorts of populations are sort of captured in both, but the types of products and the types of solutions they're focused on are, I'm not going to say different, but they only overlap in that sort of e-health, m-health space. Both of them are related to providing and creating an ecosystem of innovators, academics, health system, patients, families, advisors, practice settings, local context, champions, societies, everybody in the pool approach to trying to create the right solutions to make things possible. And both are around this idea of sort of a consortium network or hub that subject matter experts, ecosystem partners, all of you on the podcast can reach out and phone a friend and become involved as part of the work that we're doing in Alberta. So that's really what I would say. The two of them are overlapping in the middle around the digitally type things, but their focus is in slightly different areas around slightly different opportunities. But they all know the same friends.
Okay, good. Thank you for breaking that down. I feel like a lot of great opportunities. It sounds like a very unique two organizations. Would you say this is something you see in other places in Canada, or really is Alberta kind of leading the charge?
This is homegrown innovation for how we're doing innovation, which is the awesome sauce. So we actually now have a very unique environment and partnerships. And what's very neat is that if you think about them as sort of two overlapping pieces, the universities, the polytechnics, the simulation centers, all of our favorite friends are partners in both, as is the health system. So what you get is that accelerator, right? Trying to bring people in as early as possible into the innovation journey, the product development, the technology problem solution fit, right? Is this the problem we're solutioning in system, and is this direction that we're heading? That's what we're trying to make through Health Everywhere Hub and A-Medico, is to create the ecosystem where all of the things we're talking about in relation to collaboration, co-design, safety, efficacy, equity, all of these big buzzwords aren't just big buzzwords. We can actually put actions to these initiatives and accelerate through the problems and pain points that we acknowledge have been there historically. I'm going to say in the innovation space in general, but have also been a bit of a challenge in Alberta specifically because we lacked the cohesion and the direction that we now have around both the health system, the universities, technology, and innovation. So even across our ministries and the companion portfolios, everybody is now very much aligned in how we want to see ourselves as a future state within Alberta and the health innovation ecosystem specifically.
Well, I feel like our listeners and myself will be following along closely to see what comes out of that. Where would you direct us to? The website, LinkedIn, to kind of stay in tune with what is coming out?
So I would say pay attention to all the different medias that you normally do. Sign up for the newsletters. For I myself, I'm on LinkedIn. You can find me at Acute Care Alberta. You can also find me academically at, the University of Calgary and the Precision Health Program and all of the things that I do there. And honestly, I'm going to say that from an ecosystem perspective, just keeping your eyes on, keeping your phone a friend networks active and not being shy. We may not have all of the answers, but if you reach out to any of your old entry points or any of the new things that you see coming into being, if we're not the right shop, we will try to find the right friend within the new ecosystem and the development who can help and support you in those conversations. So it really doesn't matter which on-ramp you use. I'm going to say get on the ramp, come make a friend, and then we will redirect you if needed, but we will also partner with you if the opportunity presents.
Well, thank you so much for joining me today. It's so great to hear your enthusiasm, your energy, and all the knowledge and expertise that you bring to this area. Really appreciate hearing from you today.
Absolutely. Thank you for having me. And if there's any questions, concerns, queries, or otherwise, please feel free to invite me back and ask me more questions. I am always happy to support all of you in what it takes to do innovation in the health system. It's a weird and wonderful uniqueness that I am happy to support, and simulation is a key part of that. And Nate and CAMS are a key partner in that space. So I appreciate this opportunity, and thank you so much.
And that brings us to the end of today's episode of Advancing Healthcare Through Simulation. A big thank you to Tara Klassen, Innovation Lead with Surgical Care Alberta, for sharing her insights on navigating complexity, translating evidence into action, and designing sustainable innovation across the surgical continuum. Thank you for listening, and be sure to subscribe to Advancing Healthcare Through Simulation to hear more conversations with leaders who are shaping the future of healthcare innovation, safety, and teamwork. Until next time, thanks for joining us. This health innovation themed episode of Advancing Healthcare Through Simulation is brought to you by Amedico and Health Everywhere Hub.
This series is proudly produced by the team at Road 55. Road 55 creates content that connects. For more information, visit our website at road55.ca.